Hi, I'm Dr. Brian Yeung, a naturopathic doctor here in Toronto. We will be presenting a series of naturopathic weight loss tips on this channel, so subscribe if you're interested in learning more. Now, I treat a lot of people looking for weight loss, and with so many people now find themselves working at home, there are a lot of different challenges that these people now face. So, here are some tips to reduce your unwanted snacking. 1. Make it difficult to snack. Studies show that it's more effective to avoid the temptation altogether than it is to resist the temptation. When you resist the temptation is present and available, and you're constantly trying to stop yourself from succumbing to that sweet, sweet candy. Put snacks in locations of the house that are difficult to access to you. On a shelf you can't reach without a chair. In the basement, behind a couple boxes. On the roof. It's easier to avoid snacking if your snacks are not easily accessible, or even better, not in the house at all. I routinely recommend patients throw away all their snacks in the house. Out of sight, out of mind. 2. Set routines. Snacking can occur quite randomly, and you may find yourself reaching for a snack as you idly watch Netflix. To reduce random snacking, plan out when you'll eat and stick to those times. If you like 3 square meals a day and nothing in between, go with that. If you need to snack after dinner while you backstab friends in Among Us, plan for that and compensate accordingly by having a lighter dinner. If you can plan your food intake, you will reduce the likelihood of you snacking more than you should have. 3. Drink lots of liquid. Studies show that the sensation of hunger and thirst are much more intertwined than we think. Some of us will experience hunger when our body is in fact needing liquid, and vice versa. Additionally, many of us will find that drinking liquid will help satisfy our hunger. If you're the tracking type, you can set an amount of liquid you want to consume per day. I'd recommend at least 2 liters. Otherwise, whenever you feel hungry, grab a glass of water and sip on that instead for a while. See if your hunger goes away or at least decreases. What kind of liquids, you may ask? For my weight loss crew, I generally recommend 0-calorie liquids. Things like water, coffee with no milk, cream, or sugar, sparkling waters, herbal teas, things like that. 0-calorie pop is technically okay, but I have concerns about artificial sweeteners also contributing to insulin resistance and causing weight gain, but that's a story for another time. 4. Find an alternative. For those of us used to habitually snacking, you will need to distract yourself, and I find that most of us fall into 2 categories. We have the idle snackers, those snacking when they're bored or have nothing better to do. And we have the stress snackers, snacking to get a pleasurable dopamine hit while stressed. In both cases, replacing the snack with something else to do can help. It doesn't have to be the perfect replacement, since that's usually impossible, but it should help fulfill some of the reason why we started snacking in the first place. For those of us stuck in Freud's oral stage of development and just need something to chew on, sugar-free gum or even sipping a glass of water can help. For us stress eaters, we need a coping strategy for a stress that doesn't involve us stuffing our face into a bag of chips. Indulging in a hobby, watching a comedy, or some alternative to food that can help give us some stress relief. So there you have it. 4 strategies to drastically reduce your snacking. 1. Make it difficult to snack. Make snacks unavailable to you. 2. Set routines. Plan your snacks and meals beforehand. 3. Drink lots of liquid, at least 2 liters per day. And 4. Find alternatives to snacking, like a hobby or something to keep your mouth busy. As before, I'm Dr. Brian Yeung, bringing you naturopathic weight loss tips on this channel. Please leave me a comment down below if you want me to talk about a specific weight loss topic. Subscribe if you're interested in learning more, or share it with someone you know can use the help.